It's my pleasure to host you this evening. My name is Rich Groves. I manage the Academic Affairs Group here at the Next EDS, and we've put together a great series that's culminating in this evening's presentation by Dr. Amrita Reddy. She's a graduate of Boston University and is going to introduce herself a little bit more fully in just a moment or two. I just want to set some quick ground rules for you for this evening. Dr. Reddy and I are going to have a conversation and allow her to present some interesting information for you this night. And if you wouldn't mind holding your questions till the end, we'd be happy to field any of them once we make the presentation. You can use the chat window or the Q&A window inside your web browser, and at the end I'll be happy to share those with Dr. Reddy and let her try to respond with the experience and see if she can shed a little light on some of the questions you might have. And so, without any further ado, it's my pleasure to introduce you to Dr. Amrita Reddy.
Hi guys, I've been in dentistry for the past 13 years in the U.S. I have been born and brought up in India, and I moved to the States in 1999. And once I graduated from dental school in 2003 from Boston University, I ever since have been practicing here. Now I chose to join a DSO, and with the offers that I was given at that point, I thought DSO was the best that I had. And with exactly what I was looking for is an opportunity to be able to do a variety of dentistry as well as growth, And so the offer that was presented to me happens to be from a DSO, and I went for that. So in 2003, after graduating, I joined Aspen Dental Practice and managed a couple of different offices in the Mass offices, and Medford and Woburn. And after being in that environment of managing two practices and getting better with my skills, clinical as well as management skills, I moved on to owning a couple of practices in 2008. I bought two practices, one in Nashua as well as the other one in Manchester, New Hampshire. Meanwhile, in 2006, I already also had a girl, baby girl. So after a year and a half, of having her, I decided to buy these two offices and added a third practice in 2009, and then 2010 I added the Bedford, New Hampshire practice. I also had a boy in between, so I added 4 practices in a span of about 3 to 5 years, and also had 2 kids. So I have a growing family, plus now I've grown to about 6 offices, spreading to central Maine, because I noticed that there was a great opportunity and need for dentists in Maine. So opened 2 practices in central part of Maine, which are doing extremely well. So this is my background, So it's been great. The ride has been wonderful. The experience has been, great. And I got to learn a lot about managing a dental practice and how to get efficient with it, and also have be successful as a mom and a wife, and balance it all and juggle and be comfortable doing that.
Absolutely. Can you tell us, Dr. Reddy, some of those challenges when you just outlined a very full day, and what are some of the steps as our students are soon facing that same challenge? How do you find a way to strike a balance and be a good mom and a parent and a wife and a practice owner all across the New England area?
Well, I think for, what has worked for me, and I think a lot of people it does work, is a great support system. Having a great support system at home and extremely a good support system at work. I mean, when I say support system, I'm talking about executing the operational excellence, basically, and taking help of the DSO organization to make it more efficient on a day-to-day basis, figuring out the misses in the business and strategizing how to go about, minimizing those losses, as well as executing at a higher level, and yet continuing to grow in a mature market, has always been, my goal. And what has helped me is, working with the organization who has always believed in, developing their people and invested in their people. So I think, as a student, when you graduate, there's a lot of pressure out there, to want to obtain the license and then find the right place for employment, and then the student loans are high. I mean, each student nowadays is graduating with 400,000+ loans, and it's increasing every year by 10% almost. In the last decade or so, it's increased by 10%. So I think, when they graduate, having such high loans is stressful, and what you end up, earning in the first few years after school, after graduation, makes a huge difference, and paying off those loans. So I think, a lot of students, once they graduate, invest all their energy into their work, most of them, and it's just, I think, having a comfortable paycheck on a regular basis, on a monthly basis, where you know that, okay, I can pay certain loans, I still feel have a comfortable lifestyle, and that's very comforting. And having, and a lot of these DSOs offer that, a good baseline salary, where as a fresh graduate, when you are, you're not sure of your time management and how much time you require for each procedure, that you will, make a standard amount of money by the end of the year that will help you pay the loans. And what is also important is, when you are getting into the dental profession, is do you have a work-life balance? And it boils down to the quality time you spend with the family and the hobbies and the personal priorities, in order to achieve, as you said, self-worth and personal satisfaction. So I think in dentistry, one of the reasons I went for dentistry is, in the field of medicine, it has always, kind of attracted me, because it's the only field of medicine where you feel like you have a reasonable, personal life. You can work-life balance is pretty good, because you don't have to, you can be on call, but yet not necessarily go to the office, to fix a person's tooth. You can still, have a pretty good work-life balance, where you have a good support structure from an organization like a DSO, where they take care of all the marketing, all the payroll and advertising, and just take a lot of pressure off you, and where you can focus pretty much on the clinical aspect and give the patients the care they need, and do it to your best ability, and that makes it more efficient. Work smarter, not harder,
Let's talk just for a few moments, and I know that you see some of these factors that are in the marketplace right now, Dr. Reddy. There are things that affect your patients when they come in the door. There are ways that you and your staff prepare to greet those people, those challenges. And let's talk a little about some of those things that are affecting dentistry right now, some major shifts that our students should be aware of. This one's very relevant for you personally.
Right. I mean, among my 6 offices, I have about 12 dentists working for me, and among the 12 dentists, interestingly, I noticed that there's about 70% of them are female dentists. And out of the 70%, I would say that 60% of them are below 44 years of age, So it's very relevant to what I have in my practices, and I noticed that there's more and more women graduating from down schools, and it's just because purely it provides us with a work-life balance. We can juggle having a career as well as being a good mom and a wife, and it's just completely changing the dental professional scene, and it's the fastest growing segment of dentistry. So I think, in my practices, it's a live example, and the other thing I notice is the race, and there's a lot of diversity nowadays with the doctors and the dental providers. And I note I have about 70% of them are from minority communities right now in my practices. So it's changing, the scene is changing, and we just have to keep up with it and make sure we have a good ratio between the dentist and the patient population, and because a lot of times the private practitioners are opening offices in the urban areas, not the rural areas, and the DSOs tend to focus on the underserved population and go more towards the rural areas. So they are kind of bridging that gap, if I can say, the gap where there's not many dentists available, and there's an extreme need of dentistry. There's a lot of patients, looking for providers, but there's not many providers. Especially, I can talk more about what I see in the central Maine area. Among my offices, we see 15 plus patients as new patients every single day, and there's hundreds of patients waiting, to be seen. But, we can't just keep up with the pace because we need more dentists, and there's less competition, and because there's not many, private practitioners, and the DSOs are bridging the gap. So I think it's a great place to be. And, it just benefits not only the patients, but also the providers.
Were there other classmates of yours, other graduates of BU when at the time of your graduation? How viable a concept was it? Were you an outlier moving into a DSO practice at that time? It's become much more accepted since then.
Absolutely. I think, it was not very often you would, I think maybe a couple of other classmates of mine joined a DSO, and others chose to, try different things. And 13 years later, when we're all, obviously we're in touch and we talk, and we say, because things are changing so much, and they said, wow, you did the right thing, because some of them have been struggling with their private practitioners, and some people join private practices with the hope that they'll get into a partnership and ownership, but, not everyone was successful in what their goals were, so it's just, and one of my friends is in the board, dental board, and he mentioned how their approach towards DSOs has changed, how their outlook has changed too, So it's looking good, actually. That's where, most of the dentistry is going, I feel, and, we just have to just keep up with the pace and get on it.
Yeah, you were talking a little about this. This was an interesting notation as we were preparing for our evening tonight. And you said, yes, I see this trend with the relocation from the north into the Sun Belt and into the South, but Maine is an entirely different type of pattern. It's like it's a pattern in reverse.
Absolutely. And, that's what, there's a lot of, interviews that we do. So we want to go to Florida. We want to be in California. And it's interesting. Recently, I've hired 2 dentists from California. And I said, you really want to move to Maine, and you don't like the sun every day in California? You want to move to Maine because of that? Like, really? But they mentioned that, it is extremely competitive in California. And especially if you're a new grad, it is a struggle. It's a struggle. Usually, they don't get paid as much, as more experienced practitioner, and there's so much competition there that a lot of these students are looking to moving away from that state and looking for other better opportunities. And recently I hired two people from California to move to Maine, practices in Maine. And my practices, as I said, there's so much of need for dentistry. The patients are, waiting to get into the doors for weeks, before they can make it to a practice for any work because of how busy the practices are.
Great point. Really great point. Let's talk a little about mobility. I know that your practices receive a variety of bookings from patients who are looking to make appointments. Tell me about your practice and what you see from a mobility standpoint.
Well, I think all of us, are so dependent on, being like cell phones and smartphones. Two-thirds of Americans have smartphones, and I think being visible, online visibility, and having online strategies and being proactive about it and being more visible, whether it's Facebook or social media or Twitter or blogging, all these options are great. And practice management software is really going to help us also to keep track of this. So we send out basically for every new patient who walks into our door, we send out a request to give us a review, good, bad, any feedback that we can get to improve and get better. So every single new patient gets that. And from 2015, to 2016, there's a huge, change and shift. The number of patients who are doing those reviews or, giving us feedback has, exponentially increased. So it works, and it's really important to be visible out there because most of the people look at the online data before they make their next appointment or they find a provider. They're looking at the reviews online. All the consumers are doing it nowadays. So it's really important, and to be out there.
Good point. And let's talk about the consumers and how patients approach their care now. And what do they look for in your practice when you engage with them? Why do they select your practice rather than the one next door?
Consumerization, according to me, is just making everything more convenient for their visit, like affordable, convenient, and kind of giving them the opportunity to be able to even see a specialist in case they need it under the same roof. So adding more value to every visit for them, because everyone's time is so important nowadays. And rather than sending them to a specialist, go to another office, come back to me for a crown, do the root canal, we provide all that under the same roof. So giving them affordable, quality dental care and making it happen under the one roof, making it convenient and saving their time as well as our time is what I feel is consumerization, and that's what we need to get to, and dentistry is going to get there too, as you mentioned, like medicine and pharma and optical, everyone has consolidated and been doing that. So I think that's what I would say.
Excellent, excellent. And let's talk about the dynamics of the patients in your practice. What's the makeup of your practice age-wise?
Yeah, I would say anywhere between a good mix of patients from 40s, early 40s to 60s. We do see some kids as well, but it's a good diverse, population. But I would say a lot of it is between 40s to 60s.
And does that, for our listeners this evening, what does that tell them about the types of procedures that that age bracket sees most frequently? Do you have a certain, as you look at your procedures, your codes at the end of the day that you see come up more frequently?
Well, I think, I've been very lucky that, most of these practices that where I am, the southern New Hampshire part, there's a very healthy mix where we see a bit of dental, a bit of dentures, crown and bridge, as well as, there's cases where we end up doing some implants too. Not very often, But if the patient can afford it, absolutely. But a lot of restorative, dentistry, it's a good mix, I would say. And I think, how I look at it, when I joined a DSO early on, that's what I was looking for, a good variety of patients where I get to do, different procedures and improve my skill as well as time management and in a short period of time. And I got it. It's like doing a DPR, but getting paid for it.
That's a great example. I like that.
Yeah. So
I'm sure that makes sense to a lot of our guests this evening. Yeah, there's some interesting statistics that we were talking about beforehand as well about access to care and what that means.
Yeah, as I said, there's a lot of Americans that haven't been to the dentist, and because of the lack of insurance or fear of a dentist, or putting away and being non-compliant. And I still see patients like that. They avoid, procrastinate as much as possible till they're in a lot of pain. You're one of them.
Yes,
So, and I always, every day goes by, saying that, oh, I don't like the dentist. I said, okay, let's, tell me something new. I've heard this a couple of times today. But so I think, keeping, again, consumerization is going to help with that. Creating affordable dental care and accessible dental care where the patients don't feel that they're being judged when they walk into the office, and and kind of creating those resources for them or tools where they can we make it more affordable for them to figure out like I would say monthly affordable payments, finances, the office managers discuss the finances and break it down to them so that it's more affordable monthly payments, and they get a lot of work done, and over the course of the year, have comfortable payments. So we achieve that. We see a lot of those non-compliant patient base who put off the dental treatment for many years because of lack of funds or lack of awareness or, priorities were different. So that's a common thing in my offices. But we get around them, and, it's amazing to see all those smiles end of the day when, you feel like you have made a difference in someone's life. All these changes to the healthcare system are forcing our dental practices to become more efficient.
You touched on a couple of these things in your discussion with us about how your practice helps address some of these trends.
Yes. Yeah, the convenience, adding the value to their visits, trying to maximize the time that they have with the dental office. We always create the sense of urgency to starting the procedure if, on the same day, because we notice there's a lot of this non-compliant patient base who have, avoided the dentist, have the fear of the dentist, are here in our office in pain. We want to make sure we make a difference. We get them out of pain. We create that sense of urgency to take care of that problem and make sure they're comfortable, and that makes it a pleasant experience for them, and they remember and they come back. We typically do a comprehensive evaluation for most of our new patients to educate them and kind of let them know what else is happening in their mouth so that they do not neglect the other areas, and hopefully, get everything done gradually and at their comfort level. But we make it more affordable, so it just makes complete sense, for them, and it's we have a dental lab attached to the office, so that makes it easier when it comes to fabricating partials or dentures, any immediate appliance. It's much quicker, so it's very convenient for the patients. It's not too many appointments and too many days involved in it. So it's much quicker, and we stress on the urgency.
I have a question. I was going to hold it for the end, Dr. Reddy, but I think it's important just given where we are in this moment. Are there any quotas that you have to satisfy as a DSO, as a dentist in a DSO practice? Who makes the call on how your staff addresses care every day?
Oh, absolutely. We have, as practitioners, we have complete autonomy, and that's was the best part I felt. Like when I joined 13 years back, I felt like I could do what I wanted, what was needed for the patient, what I was diagnosing, what the treatment plan was. It was all under my control. So I had complete autonomy for those clinical decisions. And what I took help from was the, execution of the business part of it, the operational part of it, be it staffing, recruitment, training of the front desk, as far as, confirming appointments. It makes it easier, because that way that allows me to focus on the clinical aspects, what I'm good at, So, yeah, we have complete, freedom and, say in that. There's no quotas. There's absolutely no quotas.
Interesting point. Tell me, and so this is one of the instances that you don't have to worry about maintaining a website yourself because you have support for that from your back-end provider.
Oh, yes, absolutely. And yeah, the website, the call center helps us to make all the new patient appointments. The staffing is all done by the recruitment department. Doctor interviews, everything is taken care of. Of course, we do all the interviews. I select all my doctors after, screening them. There's a legal department that's always been there in case we need advice, There's a marketing department. I don't have to stress about whether I'll have a new patient coming in tomorrow morning or not. It's great support system, all over, like payroll department. So a lot of pressure is taken off. And, the company website, caters to all details, and it's pretty much conveniently, located. So I think one of the other things that helps is to be able to connect with your peers and having the software and having that application which is designed. Aspen is designing something that is completely going to be so accessible on the cell phone that it makes it easier for us to connect with the peers, exchange ideas, interact, discuss about cases, and having that, mentor, who could help us out in challenging cases is all a big plus. And also, we have this mobile dental office, the Healthy Mouth Movement. We do this dental facility travels around the country, and it's coming into New Hampshire this week. In fact, on Friday, and I'm going to be in charge of that in New Hampshire in Concord, and we're going to be providing free dental service the whole day from 8 in the morning to 4 in the evening. The number of patients who are going to come in, we're going to get them out of pain in whatever procedures we can, So there's 2 dental chairs and a full set of instruments, be it for extractions or hygiene. We have a hygienist, 2 hygienists, 2 doctors who are giving away, dentistry and helping the community, giving back to the community. So that's one thing that we have been always been actively doing around the country throughout the year. We're also doing a free day of service. So in June, there's Saturdays we are open to give care to all the veterans. So whoever comes into the office, we give free care. So that's a big a nice way of giving back again. So we've always been very active doing that, several years since that I've been involved. And NASCAR, Danica Patrick, who doesn't know her? Like, she's one of those popular celebrities. Recently there was, I don't know whether you've caught up on that YouTube video, but in a NASCAR race in, I think,
Yes.
Talladega?
Yes.
Right? That's where it was. And they've asked some of the audience, like, what would you like to go? What would you need to go to a dentist? And some people said a car, and they were presented a car before, and they were taken to Aspen Dental office. They were flown to the Aspen Dental. So it was interesting to see all that. But yeah, there's a lot of charitable events that Aspen does, and we try from our end to give back to the community.
Let's talk for a few moments about some of the other options that you have when it comes to access to technology. You have a practice, you have multiple practices. Let's talk for the students' benefit about how you make selections on what is in your office and the type of efficiencies that those things provide you.
So, before we purchase a big item, we always do we choose to pilot that item. So we go over a course of 2 to 3 months, we test that, we get a good pricing. Aspen negotiates for a good price because of the group practice negotiating power, so we get a good price on it. We try the item. If we like it and we see the benefits of adding that technology, we go ahead and purchase that. We have complete say on that too. So it just depends upon if it makes business sense. And we have all the data, all the metrics. We record it for about 3 months period, and then go for it if it makes sense.
And that really occurs across several different phases. You had mentioned previously how important an accurate diagnosis is to all of your treatment planning. What types of approaches does your staff use when you're looking at a patient for the first time?
Digital radiography is one of the most important things, and some of the offices have intraoral cameras. Not all, but some do. Digital charting for the root canals, we have all the tools for that. And basically digital radiography is one of the biggest things. Caries detection.
Then it comes time to talk to your patients, and you're speaking to us actually right now from one of those technologies. You have a dedicated consultation room so you can speak to the patients. What role do their records play when you're having that conversation with them?
Well, it's all, we, as soon as the doctor does the diagnosis and writes down everything that's needed, even the assistant is typing down in on the computer, the office manager gets all the information, and by the time the doctor does the handoff and communicates everything that was discussed CHAIRSIDE in front of the office manager, and does the handoff to the office manager, it's pretty much made it so convenient, the software, that it's a quick process for the treatment planning presentation as far as the estimates are given. The OMs are giving, or office managers are giving only the estimates, only the finances part. So the dentist does most of the CHAIRSIDE conversation about what's needed and why it's needed, and the cost is given by the doctor or by the office manager. So it's just convenient, conveniently, the flow is very convenient. So.
I know you touched on this earlier, but I saw some folks come and join us while we were in progress. Do you present comprehensive dentistry? How do you approach your patients when they come to you with a chief complaint of some kind?
We, though they might have a chief complaint or a specific problem or specific area that's brought them in, we always treat them comprehensively. We do educate them why it is important to look at the entire mouth and come up with the overall treatment plan, definitely addressing their chief complaint and sequencing it in such a way that we always address that the first and get them out of pain and, treat that issue first. But we always do a full set of x-rays, a panoramic x-ray, digital x-ray, review everything that we see, what are the main concerning factors, what needs to be prioritized, and sequence it that way. And so they have an overall picture of how they need to plan and what the next several months might look like as far as dental costs are concerned, and how they could do budgeting. And they then meet the office manager, who helps them to, again, break it down and space it the way they're comfortable financially, and go over some of the financial options that they offer, make it more affordable, monthly payments.
And is this a system that you developed yourself in your practices? Is it something you worked on when you were being mentored yourself? How
Yes.
did the system come into play?
Yes, and I think each owner probably has their own style, but I think this has worked for me and gives a more long-term success for the patient's treatment plan as well as the business. It just makes complete sense to do it that way, so that it's not patchwork and we don't go backwards. In fact, like we fix something but something else breaks and we take another X-ray, and I've seen different styles, but for me to have a baseline for blood pressure when they're walking in, for doing a complete perio charting to understand where their hygiene level is and what their history, the medical history is, keeping all that in mind, plus looking at the X-rays, tying it all together and coming up with a plan has always worked for me and the patient, so that we have a plan in place for the next 6 months in case they need a lot of work. So.
Excellent, excellent. And what about chairside technologies? You talked about endodontics and your staff's readiness to perform. Some of these things that I know you're looking at, one of these, for example, you said digital intraoral scanning has been included in one of your first practices as well.
Yes, for the crown and bridge. So we've been piloting that for the last couple of months, and it's working great. And the turnaround time for these crowns are pretty much 4 days. Typically, when we use a lab and send them impressions, it takes about 14 days to get a crown back and to be inserted. And nowadays, again, patients want a lot done and they want it done quickly. They don't want to take too much time off from work. So if we can make it happen, and make it happen whether we have a CEREC machine in the office or whether we have intraoral scanning and have digital, scanners to help to facilitate much quicker crown inserts. We're trying this and it's working well. It's definitely increased. More number of crowns are being inserted, as well as patients are happier because they don't have to be in a temporary crown for an extended period of time. So in a way, it's convenient for them too. So it's working well.
Excellent. It's a win-win.
It's a win-win.
And tell me about lasers. I know that it's everybody has their own approach to it. Have you given consideration to a technology such as lasers for your practice?
Oh yes, we have lasers. We use it for crown lengthening procedures, for gingivectomies. Helps to kind of heal the wound much faster, reduce the bleeding, and makes it more accessible and easier to work in that environment, and have a lesser number of bacterial infections. So I've had a very positive experience. I mean, for crenectomies, I use it. For crown lengthening, crenectomies, as well as gingivectomy. So we do. I love surgery, so I do a lot of surgery. And when you have it and you enjoy using it, you find areas to use it.
I think the BU staff is very happy to hear that. And tell me, and you've seen, and in fact, this is a very personal story for me, just because someone in my family just took this first step tonight, picked up her first set of aligners. Tell me, is digital orthodontics a consideration for you and/or your referring orthodontist at this point?
Well, referring orthodontists, yes. Maybe not yet in our practice, because I don't see as much of, I don't see as many patients who are interested in this yet. But referring orthodontists, absolutely, I would say.
Excellent, excellent. And so it also is about more. You touched on this briefly in previous, that it's not just about the systems you have in place or the chairside technologies, but it's how the system itself helps you integrate all that information so that each person in your staff has access as quickly as possible.
Yes, absolutely. And, that makes it so much easier for the flow. The patients don't wait as much. Scheduling appointments is much easier. We keep it productive. It's a fast-paced environment, so time is valuable. And anything to make it more convenient for everyone so that nobody waits And this is what we do. I mean, it's just the software that we have, and everyone is comfortable using it, and it just makes it more productive and improves the overall business and the operations.
And as you said too, it's getting more portable and more accessible for you too.
Exactly. And yeah, as I said, 2/3 of the American population are into smartphones, and everything is at the tip of our fingers. We are always on devices, and we are mostly doing majority. We are making appointments, we are confirming appointments, we are doing reviews, we are looking at the online reports before making appointments. We are constantly on our cell phones or, any kind of, this social network and media. So we have to get on it, otherwise it's tough to catch up.
Yes, for sure. Good point. And I understand that you're having a new service availed to you as practitioners as well through electronic prescribing.
I think electronic prescribing, we've been on it for the last, I think, beginning of this year, and it's a huge plus point because it saves so much time, minimizes the wait times for the patients in the pharmacies, as well as, helps us to kind of gauge the patient prescription history. We know if they're drug abusers or, if they have any adverse reactions to any particular drug, cross reactions. So, and they are also, integrated with lexicon. So that's a very big plus because we know if there's any cross reactions, we know what to avoid. So that's a big positive change there.
Excellent.
And no writing down prescriptions. So while it saves time.
And you said that all of this is translated to making the demand in your office is something that you can see almost every day. You spoke to waiting and having a full chair. How far out are you scheduled in your practice this day?
It varies. Yeah, it varies. In Southern New Hampshire, probably, I would say, we are booked out probably about a week. And in Maine, for at least minimum couple of weeks before we can bring a new patient in. So, and we are seeing about 12 new patients a day.
Wow.
And so, it is busy. And, so, I mean.
That's why that balance is so important, right?
Absolutely. We have crazy busy days. Oh, this guy is familiar.
Indeed. Dr. Gillen was our speaker just several weeks ago talking about some of these consumer trends that we touched on very briefly.
Cool.
I'm just going to ask one more question. If you can talk about some of the things that your time in the DSO practice, some of the things that you would share as summaries for your listeners tonight.
My time, for me, it worked out great because what I was looking for is growth and exposure to a variety of procedures, and I like to be challenged. I like change, and I'm constantly looking for a change. I get bored soon, so I'm looking for procedures that can excite me, technologies that interest me, and growth was always something that I was looking for. So I got it. I got it all in this, this option that I took, and I'm extremely happy. If I look back, would I have done it any different? Absolutely no. I think to be able to run 6 practices successfully, plus also balance it by, for being a mom, being there for the kids as well as a wife, I think it's a lot, and I wouldn't be able to do it if I didn't have that strong support structure for me. And that's, as in the office, it comes from the back-end work that is being done for me, whether it's calling the insurances, negotiating with the insurances, making sure the marketing is done, all the technology that's in place. A lot is done by the DS organization that takes the pressure off. So I think, it's been great. It's been great experience, and they've always invested in their people and to develop the people and to get better at the leadership. So I think all put together, it's a great place to be. And it's not for everybody, but I think if your head is right and if you're looking for growth, if you're looking for a great earning potential by doing the right thing for the patient and being creating accessible dental care, affordable dental care, and you are fine to treat patients where they're non-compliant based patients, it's great setup.
And so you said it might not be the right fit for everybody. Can you, just before we get to open the questions up for our audience, can you share, some of the things that every graduating dental student or soon to be graduating student should be thinking about as they're evaluating a DSO practice versus other options they have in an associateship or solo practices? What are some of those things in your mind that should be in place for them?
Well, I think it's one of the most important thing is work environment. Is the environment comfortable and healthy? Is it something that they can relate to? Are people in the office approachable? Is there a mentor? Is there a guide? Someone who is more senior to them as a dentist? Is there a senior dentist around to be the big brother or big sister to look over the shoulder in case they're stuck in a procedure or to bail them out? I think that's one of the biggest things you need, the support from a more experienced dentist when you're right out of dental school, out there in the real world, to have that mentor, around to help out in case of, some complex cases. The other important thing is the culture. The culture and the environment is key. And is there a growth? Is there growth in that particular practice? And with the DSO that I work for, I think most of the DSOs can get busy. And why I say it's not for everybody is it depends upon what they're looking for. If they're looking to see very minimal number of patients, a very slow-paced environment, not under pressure, and where they want to see 3 or 4 new patients at all, in the whole day, then definitely it's not for them. It's more higher pace. We have enough time to settle in, feel comfortable. There's always a mentor doctor in each of these offices to help out, but it's never like from first day you're going to see 30 patients. Never. You're going to start off with 3 or 4 new patients. Depending upon the pace that you like, you're going to slowly add to your production and your schedule, depending upon your pace. So you have the freedom for all that, but over time, over a year's time of being in the practice, you will see a lot more patients. Now, a lot of private practices may not have that kind of patient pool to give you a lot of procedures or a variety of cases, where either it's crown and bridge or dental, remo, dentures. It's a more slower environment. So it depends on what they're looking for.
That's great. That's great. Thank you for sharing some of that insight for sure. All right, folks, as I mentioned just a moment ago, if you have any questions for Dr. Reddy, I know that she's welcoming those at this time. And just as a way of sharing one of the ones that's come across while we were chatting, actually, I'm gonna pose this one, and then I'll finish with the summary with you, Dr. Reddy. Then we'll get to the questions. One of the first questions, when you have as a practice owner, what qualities are you looking for in your applicants and your new hires? And all of these folks are soon to be in those shoes. What are you looking for in your potential new associates?
I'm looking for people who have the drive, who are very enthusiastic about and motivated to learn, and are going to be team players. I think these are the 2 really important things that I look for. The skills gradually can be taught. The speed, the time management gets better. But I think the motivation and the drive is something that's inherent, and and it's just something that I can't teach. So I think, yeah, and a team player. That's all, because it's all about teamwork. Be it the dental assistants to the receptionist to the doctor. Everyone has to be a good team player for the whole practice to be successful.
That's a great point. Another question is, in what format or form do you use for soliciting the feedback from your patients?
The online reviews?
Yes, ma'am.
Could you go back on that, please?
When you were talking about the process by which you ask all of your new patients for their reviews, that when they're from the very first time, what tool do you use? Yelp? Do you use an online form? Do you use a comment card? What format does that take?
We do Yelp. Yelp and format form, yeah.
Excellent. So they could find that right in that same dynamic. Okay, cool.
Yes.
And failures, that same student's asking, failures happen in every single practice. How do you manage them inside a DSO-supported practice? Are there any circumstances that are different from any other private practice?
No, absolutely not. I mean, failures as far as the any particular dental procedures failing and the solution that you can come up with, it's all up to you, and you as a clinician can decide what the patient requires, and you have the complete authority of making that change and doing the right by the patient.
When you talked about determining the comfort or how comfortable an office is or that culture, how does a student, when they're approaching for the first time, what are the steps they can take so that they get to know a little about your practice and your managing clinical directors, your staff? How do they know that from their first visit as a potential applicant?
Well, I think, one of the important things that I do is, after doing the first set of interviews, I always invite the individual to come and shadow us for a few hours, and that has helped both ways, for us to be able to gauge that individual, and for the practitioner, new graduate, to understand what the practice is all about, or the philosophy or the culture of the practice is for them. Do they value that, and do they relate to that? And I think by shadowing for a day or two, or even for half a day, that makes a lot of difference, and might have a different perspective about how they want to do it, take it from there. I've always encouraged that, and I rather have them do that, so that we have it's a win-win for both parties.
For certain. We just have, I think, maybe one more question before we wrap up for the evening. What's the best tip or piece of advice you received from your mentor when you were in that less experienced state of your career? What was that best recommendation that you might pass along in similar fashion to our audience tonight?
Well, treat every patient as if they are your mother, and do it right by the patient at all times. Practice with integrity, and I think that is it. I've always treated every patient that is in my chair, the same way I would treat my mother, and I think that has helped. Indeed.
Okay, one last one, and then we'll wrap up for the night. In dental school, students spend 1 to 2 visits to collect medical histories, as you know, and then clear the patient for treatment. How does that occur in the practice setting?
So when the patient walks in, we basically, they have to fill the new patient exam forms, and the medical history has to be done right away. And once we read the chief complaint, we bring them in, do the full set of x-rays. The first set of, the receptionists usually look through the medical history. They don't know much about the details, but they will alert us with any positive things that are concerning things that, they put the highlighters, the stickers. And the dental assistant goes in, does the new patient exam, the x-rays, the doctor goes in, and actually we spend about 10 minutes after the blood pressure and all is taken by the DAs to review the medical history line by line, literally. So about 10 minutes of the consult, we review the medical history and then ask any elaborate questions that are required to, know more about the medications or blood thinners and all the details, and make sure we write down all of that on that sheet. Because some of the patients don't realize, how important it is to give us all the information and all the med lists, and they think it's not that important to let the dentist know because it's the doctor who has given the medicines. It's like, how is it related to my mouth, So, but we always take that time to invest in that new patient consult and understand everything about the medical history, And if we have to communicate with the physician, as far as Coumadin or any of the blood thinners, we always send out medical releases with all the necessary questions to get the answers and approval from their physicians to keep them in the loop if we are doing any surgical procedures.
Fantastic. That interdisciplinary care we really see starting to gain some speed both in the schools and certainly as you're describing it here in real practice every day.
Absolutely.
All right, students, thanks for joining us this evening. And a special thanks to Dr. Amrita Reddy for spending her evening after a very full day filled with administrative, clinical, and other details caring for her patients. Thanks so much, Dr. Reddy, for spending your time and sharing your insights with us all tonight. We really appreciate it.
It was a pleasure. Thank you.
Thanks also to Aspen Dental for their support and enabling us to bring this information to you. This is the final of our 4-part series on these business aspects of dentistry. We welcome your feedback, and if you wouldn't mind taking just a brief moment before you depart for the night and fill out the survey just so we can understand how we can continue to bring you good information courtesy of great practitioners like Dr. Reddy and on behalf of the next EDS. Thanks, everyone. Have a lovely evening. Bye-bye.